Hello viewers, I am Dr. Shaileshkumar Garge, Vascular Intervention Radiologist. Watch this video till the end. In the end, I'll show you a live surgery, that is live balloon angioplasty of one of the patient who developed these symptoms. Today, we'll see and discuss about the peripheral arterial disease, especially its treatment. Peripheral arterial disease are becoming very common these days because of diabetes, hypertension and other lifestyle changes, our food habit, diet habit, sedentary lifestyle and smoking. These are the main reasons and risk factors for peripheral arterial disease. So in short, we'll see what is peripheral arterial disease. So peripheral arterial disease, peripheral in the sense like limbs, upper limb and lower limb, but mainly it affects the lower limbs, legs. So what happens, the blood flow, arteries carries the pure blood from heart to the legs and back to the heart for purification by the veins. So arteries, they get clogged with this impure material like cholesterol, nicotine, and these blood vessels, they get blocked over a period of time. So hypertension with blood vessels become thick because of the high pressure. Diabetes, the sugar and other calcium and plaques, they get deposited in the blood vessels and they get clogged. Smoking, the nicotine get deposited and there will be inflammation of the blood vessels and causing them narrowing of the blood vessels. Change in the lifestyle, sedentary lifestyle, increase in your cholesterol levels, all this cholesterol will go and get deposited in our blood vessels. So mostly the lower limbs, that is the legs, are getting affected. So once these blood vessels get clogged, so what will happen? The blood will not flow to your toes, the will not flow to your feet, and slowly when you are walking, the muscles require the blood, more blood when you are walking or running. So during the walking, these clogged blood vessels will not be able to supply the required or increased blood demand by these muscles, and you start getting the symptoms. So what are the symptoms? So it starts with pain when you are walking. So you have to sit for some time. So the muscle get relaxed, the blood flow starts again back to the normal, and again patient feel better and they start walking. This is called in medical terminology as intermittent claudication. Claudication means pain during walking. You sit for some time, you feel better, again you start walking. Once you start walking for certain distance, again you start feeling pain, you sit down, you take a rest, you will feel better. So this is intermittent claudication. So these are early indications of the peripheral arterial disease, that is a clogged blood vessels in your legs. So once you neglect these symptoms and try to delay the disease or delay the treatment, so what happens, the more blood vessels get clogged, the severity of the clogging of the blood vessels, like we always hear when you go to doctor that your blood vessels are blocked, or there is 90% blockage in your blood vessels, 70% blockage in your blood vessels. So early blockages may cause your intermittent claudication. As the blockages, the severity of the blockage, like it becomes 90-95%, so then the rest of the symptoms will start. What are the other symptoms? Like rest pain. So you start feeling the pain even in your legs, even when you are at rest. No need to walk also. The muscle cramp starts because there is not any much blood supply, pure blood to the muscles. So your muscles start aching and they go into the cramps. And if you delay more, the tissue injury will happen. That is, you start getting a small ulcers. Sometimes you will have a very trivial injury or small injury, but that injury will not heal as in a normal patient, because any healing or any normal process of healing will take a adequate normal blood supply. But because your blood vessels are clogged, there is no adequate oxygenation or nutrients reaching till the ulcer or the wound, so your wound will not heal, and there is more possibility the wound, because of the impurities, because of the carbon dioxide, the wound may get infected and it will start becoming pus formation. So these are the other moderate stage risk factors. And if it becomes more severe, suppose if the blood vessels getting 99% blocked or 100% blocked, so you start losing the limb. That is called gangrene. So gangrene is a dead tissue becoming in the part. Sometimes you see that because the limb getting or toes or the feet getting black, and you see the doctor cutting the black part, that is the dead tissue, we call it as a gangrene. So these gangrenes start forming depending upon the location of the blood vessels, where it is blocked, how much severity is it blocked, whether there is any collaterals, you start getting these gangrene parts. So slowly, if you don't treat at this point also, the gangrene may progress further progressively upwards, like you may start losing the toes early, then later foot, then the leg is cut, then in the proximal part we progressing till the thigh region. So it is always important to identify these symptoms at the early stage. See your doctor, try to rectify the risk factors, like I said, diabetes, hypertension, smoking, self-care, change in the lifestyle, sedentary activities, try to become more active, do regular exercises. So these will help in correcting the early diseases. But if you don't recognize in the early diseases, the disease become moderately severe, where the ulcers are forming, small wounds are forming, and wounds are not healing, then at that time you may require medications like blood thinners, so that the blood will try to flow till the distal part. Along with that, blood vessels dilator, so that the diameter of the blood vessels increases and the blood will try to reach through the narrowed blocked blood vessel. And if you are correcting the risk factors, like starting the if you are diabetic, starting the anti-diabetic medicines, anti-hypertensive medicines if you are hypertensive, controlling the cholesterol, quitting the smoking, all these factors are also very important. But if it becomes very severe and you are feeling the rest pain, or you are feeling or you are developing gangrene, chances of gangrene or non-healing wound, you better seek proper treatment with a vascular intervention radiologist or vascular surgeon. Because there is possibility, if you don't treat at this point, you may lose the limb. So what are the treatment options are available? So the important treatments are angioplasty, same like in heart. When the blockages are there, the doctor do the angiography, identify the block and length and diameter, and put a balloon to open the blockage, and if required put a stent. So that is called balloon angioplasty, plus or minus, if required stent will be placed by your doctor. So most of the times this stenting and balloon angioplasty is enough to restore the blood, but you have to control the risk factors, you have to change the lifestyle. All those risk factors are mandatory. Along with that, you have to continue the medications are also, so that the balloon angioplasty or the stenting which was done, it will remain patent for longer time. And if the blockages are very large and there is no flow distally at all, sometimes you may require bypass surgery also. But most of the patients, they improve with the stenting and balloon angioplasty if it's a short segment block or a moderately severe block. If the blockage is very severe and angioplasty or stenting doesn't work, then ultimately you may require the amputation of the leg. So limb is very important. Try to save or salvage the limb. Try to identify the symptoms early, so that you can meet your doctor and start giving the treatment to you at early stage, so that you don't progress to the very severe. So now I will show you a patient who has 100% blockage in his left thigh region. He was developing intermittent claudication and sometimes rest pain as well. So we have done an angioplasty, balloon angioplasty, and luckily this patient didn't require any stent placement or any bypass surgery. So he improved with balloon angioplasty. Now his blood supply is restored to his foot. So the patient has recovered completely, and now he is able to walk freely without any rest pain. But even with this, we have instructed him to stop the smoking and continue the medication, so that in future there are no new blockages in rest of the leg. So watch this video. If you have any doubt and comments, please put them in the comment box. I'll be happy to answer them. Thank you.